1st of May, it is mandatory for all Belizeans who leave their home to use some form of face covering. The science behind face covers and its protection from the novel coronavirus are mixed, and the recommendations from health experts are the same. For example, the World Health Organization maintains its recommendation that people should wear face masks if they are healthcare workers, if they have respiratory symptoms, or if they're caring for somebody with symptoms. While the U.S. Center for Disease Control and Prevention recommends wearing cloth face coverings in public settings where other social distancing measures are challenging to maintain. But in Belize, the only debate is wear a mask or face the very rigid consequences, a $5,000 fine or 2 years imprisonment. And as you move around public spaces, it seems that by and large, Belizeans have chosen to stick with the regulations. We see surgical masks, cloth masks, makeshift masks, even newspaper masks. What you're also very likely to see is the improper use of masks. Pediatrician Dr. Cecilia Eck acknowledges that while these kinds of habits can be expected, they must also be corrected.
Now, we do know that with the COVID-19 and this novel virus coming up, we're going through a learning curve.
A learning curve that we all have to catch up on as everyday mask users. Doctors have a standard protocol for putting on, wearing, removing, and disposing of masks. Here's Dr. X's synopsis of proper mask etiquette. It always starts with cleaning your hands.
The first one are the regular masks that are reusable that you could make at home and put all the different designs on it. Those are made and done, in most cases, to prevent you from spreading the virus to me or to the people you encounter. It should not be too tight, so much so that it leaves a mark on your face, but it should be comfortable enough for you to wear. 2, after putting it on, try your utmost best to not touch the front of the mask. Don't touch it, don't rub it, don't move it as best as you could. And I know it's very, very difficult. Once you get at home, do not touch the front of the mask. Remove the straps. And if you have somebody to help you, let them remove it from the back. And then that mask goes into a bin, sometimes with bleach and water, and you launder it independently.
The masks can be dried and then reused.
For the N95 mask, for the surgical mask, for the masks that protect the user, those are usually single-use masks. Gets moist, you have to discard it. I know the surgeons would put on a new one for each individual surgery because after a while, once it becomes moist, even if it dries, the integrity of the mask is gone. The reason you put on a mask is to prevent the virus from getting into the biggest opening in your body, your mouth, your nose, your eyes. If you touch it, you literally bring that virus that you're trying to prevent literally to that surface. If the surface is wet, the virus can easily get in and infect you. And that's the reason why when you get at home, remove it from the edges, from the bottom, and discard it.
He stresses that these masks are single-use only and you should throw them out immediately after you take it off. As for children, here's the pediatrician's advice.
With the very young children, we know that it's a hindrance to them. It can, in fact, offer some or a level of suffocation for them. It is a risk to young kids, especially the ones who have underlying illnesses like heart disease or asthma. It makes no sense to put any hindrance in front of their noses. Certainly as well for kids who are less than 2, who don't have an understanding that this should be put on and remain there, they will touch it. But what we do to protect them is that we put it on the right way. Everybody around, if they wear their mask the right way, if they practice social distancing and wash their hands, the kids will be less at risk.
Proper mask use starts and ends with clean hands. Putting on the masks from the straps, ensuring that it fits snugly and covers from the nose to the chin. Not touching the mask. Removing once again from the straps only and discarding or disinfecting immediately after removal. Most importantly, masks are not a substitute for all other preventative practices.
This is a change, a paradigm shift. We should start to think differently. We should look on China now and know that they were ahead of the game. Remember as well, in between anything we do, Wash hands, use the detergent. Try not to touch surfaces if you don't have to. The mask is but one of the ammunition in your armory that protects you. Social distancing remain one of the greatest things that would protect the spread of this virus and cross-contamination. We also need to remember that there are different waves that would come, so we shouldn't let our guard down.